Hi there. Happy Thursday, everyone. I'm Rendi Murphree, epidemiologist and Director of Disease Surveillance and Environmental Services at the Mobile County Health Department, here to give you our daily update of how the COVID-19 pandemic is affecting Mobile County. First, I'll start with the global perspective worldwide. This morning, around 4.4 million cases of COVID-19 had been reported across the globe, with nearly 300,000 deaths. In the United States, almost 1.4 million COVID-19 cases reported, with 84,000 deaths. And in Alabama this morning, 10,700 cases of COVID-19 reported among Alabama residents, with 450 who died from their illness. In Mobile County this morning, we're reporting on 1,559 cases of COVID-19 disease, with 195 hospitalized and 97 who died with COVID disease. That's up a couple of deaths since we reported yesterday. Just, a stark reminder that this is a serious disease for much of our population, and is continuing to claim the lives of Mobile County residents. So a little bit more maybe about, just try to find something new or different to tell you about what's going on in our cases. We've been saying that the most severe complications and deaths are occurring mostly among our residents who are age 65 and over, but also in younger people who have underlying conditions. But the majority of our cases are actually reported among 25 to 64-year-olds. So those are the people that we think are responsible for most of the community-based transmission, or the person-to-person spread that's going on out in our community, as opposed to the people who are 65 and over that are more likely to be staying at home or be in an institutionalized setting. So it's important that we recognize that widespread community transmission is still ongoing, and we see a lot of cases in that younger age group, those younger age groups who luckily will have mild illness or illness that can be managed at home, and they will recover. But again, we're the ones, we are the ones that are probably, or that are responsible for spreading it around the community. That, and also healthcare workers. We know about 15% of our cases are among healthcare workers. And it's important to talk about that, not to blame them for transmission, but to recognize that they are at greater risk of infection and transmission because of the essential work that they do to try to care for our most sick patients who are hospitalized or in long-term care facilities with COVID-19 disease. So those of you who are healthcare workers, again, need to take extra special precautions to protect yourself from infection, but also to protect those around you from catching COVID from you. So just keep that sort of in your brain when you are deciding about going to retail locations, or having dinner in a restaurant, or going to church. Just try to continue to wear your face coverings and maintain that 6-foot distance from other people. We continue to see cases arise in employees and residents of long-term care facilities. So about 20 or so % of our cases fall into this category. They're either employees or residents of a long-term care facility. And we have been reporting and continue to consult with all of our long-term care facilities around Mobile County. This includes nursing homes, assisted living, and specialty care. So specialty care are things like rehabilitation centers or memory care centers. We have outbreaks in at least 7 of the nursing homes and long-term care facilities around our county. We consult with them on a regular basis to make sure that they have our support and our consultation, and that we can assist them in any way possible to sort of be their B team while they're in the weeds, with taking care of patients and making sure that they're caring for people while maintaining infection control. We can kind of look at things at a higher level and maybe talk about things that they can do that they haven't thought about before. So all of the facilities that have outbreaks, we again are talking with them weekly and helping them make sure that they're following the most recent CDC guidance, because it changes frequently. That that if they have needs of testing materials or personal protective equipment, that we are helping them fill those needs if we can through some of the stockpiles that we have been able to receive from our state health partners and our emergency management agencies, and connecting them with people who want to donate cloth masks and cloth gowns for their residents, or for some of their workers that don't provide health care. So just wanted to mention that we talk with you all the time, and we are very proud of the work that you're doing, and we will continue to support you in any way that we can. All right. About hospitalization and death, we've talked a lot about, 90% of the people who are hospitalized are 50 and over. Someone asked a question: is 50 a risk factor by itself, or is it 50 and an underlying medical condition? Mostly between 50 and 65. I mean, there are no hard lines in the sand, but usually it's both age and underlying medical condition that leads to a severe complication. But we have seen hospitalization in people younger than 50 who had underlying conditions. So it's age and underlying conditions, and sometimes both. Sometimes it's a little hard to tease that out. Let's see, of the COVID patients that have died, again, 95% of them had documented underlying medical conditions. All of our COVID patients that have died were either in the hospital or in a nursing home at the time of death. So 49 of them, or 50% of them, were residents in a long-term care facility. To provide a little bit more context on that, these deaths that have occurred in long-term care facilities, there are extenuating circumstances for many of them. We are finding out from the nursing homes that many of these patients who have been long-term residents of a facility, really they and their families had opted to select hospice over aggressive treatment for COVID disease. And some of them that pass away in the residence have made that choice deliberately to remain in their residence with the staff that have been caring for them through the end of their life, as they go through the end stage of their life, rather than going to a hospital and aggressively trying to fight against their COVID infection. So I just don't want you to think that people who are dying in long-term care facilities are dying there because there are no other options to care for them, like in a hospital or something like that. But that's not the case. Many of them, with their families' decision and support, are deciding to end their life using hospice rather than aggressively fighting COVID infection at a hospital. A little bit about the geography. I heard from a healthcare provider in southern Mobile today that they are just now starting to see multiple positive PCR results come back in their community. So places down along our southern border, Coden, Biola Battery, folks that live in Theodore or Dauphin Island, the southern parts of most southern parts of Mobile, keep your guard up, because we started seeing cases there a lot later than we did in other parts of the county, and it looks like it may be heating up there now. And so please continue to adhere to the public health orders and stay at home if you're sick, social distance, wear a face covering, call ahead if you need to seek health care, and wash your hands, cover your cough, those sorts of things that we've been advising for quite some time. All right, so a couple of questions. Not sure I'm going to be able to get to all of these today, but we will give it a try. So someone was asking me to confirm about deaths at long-term care facilities. Again, we know we have deaths occurring in our long-term care facilities. Those are included in our daily numbers. And then the statement or the question went on to ask about something that the Alabama Department of Public Health said recently, that the Centers for Medicaid and Medicare will soon be releasing the names of facilities who have COVID cases and releasing more statistics on that. That order, so what's happening is that CMS previously had requested that nursing homes report to them on disease and outbreaks that happen in their facilities, but it wasn't mandatory. So CMS is making a change in that, and they're going to require reporting starting very soon, maybe even already, I'm not sure. But and we have heard or been told that CMS may provide information to the public that has not previously been available about the number of cases, COVID cases and COVID deaths in nursing homes. But again, that's a Centers for Medicaid and Medicare requirement of the nursing homes. And if that information becomes publicly available, we'll try to show you how to find it. Here is a question about a delay in the length of time that it takes to get a test result back. Yes, early on, everyone had delays in getting test results back because there were just such short supply of materials and reagents and those kinds of things. Now we see sometimes labs will have trouble if, for example, their supply chain has an interruption, or a machine breaks down, or their internet gets corrupted and they're not able to electronically transmit information. So yes, there have been episodes of that where labs have had unexpected challenges that resulted in a delay of getting test results out to people. Let's see. Yeah, that was about testing. There's a question about the length of time, like how long does illness occur once you have a COVID infection. This is, I'll try to run this information. I hope to do that as an average, but we know that the length of illness can vary greatly, and it depends on your health, your age, your underlying medical conditions, if you're immunocompromised, if you have access to some of the treatments that are ongoing through clinical trials, those kinds of things. So it is it's a tough calculation to make, but people who have reported being ill for weeks on end generally have some underlying medical condition or something in their immune system that makes it more difficult for them to fight off the infection. So there's a question about contact tracing. You may have seen some stuff in the news about how many people it's going to take to conduct contact tracing for all of the people who've been exposed to cases. And so our infectious disease and outbreaks unit is usually 2 people. And they're the ones that would do case investigations and contact investigations during normal business. And right now we have added probably 15 people at least to that team. So we have added investigators that normally investigate tuberculosis and sexually transmitted infections and HIV, and we've added those folks, nurses and disease investigators, to the team that investigates COVID cases. We've borrowed some of our environmental health specialists to begin working with that team to contact the contacts and find out how they're doing. They're doing that team is doing a great job, and they've been super helpful in us understanding how many contacts are turning into cases. We have some medical students that are doing internship, or like through their college, are doing sort of like an internship with us, but for a grade, I think. And they are working remotely to help us on contact tracing. So yes, we are continuing to expand our capacity for case investigation, for contact investigation, and for outbreak investigation. Let's see. With hotel, pools, and spas reopening, what advice do we give families regarding a visit to a swimming pool, inside or outside a hotel? So there are guidelines for beaches. I don't seem to have it with me, but basically it's, only go with your family unit, stay 6 feet apart from other people, wash your hands before and after, those sorts of things. So again, though, there are guidelines specifically for beaches and pools. And that also applies to, therapeutic massages or whirlpools. Are these activities safe? Again, there are guidelines for, I think I actually have those guidelines for close contact personal service businesses, which would be a massage therapist. So in addition to what's specified in the state order, this, that you can get online yourself and read, it includes things like hand hygiene, personal protective equipment, customer interactions, like, making appointments and maybe doing that online, using cashless payment systems, thermometers, signs, ask people if they've been sick, practice social distancing by separating chairs or beds in rooms by themselves or at least 6 feet apart, disinfection recommendations, some things that are temporarily disallowed, like common drinking stations, magazine, books, or newspaper piles that you see when you go to get your nails done, removing candy dishes, removing product testers and samples, those sorts of things. So go to the guidance documents. There's a whole rainbow of them, and you can get the details on what you are to do if you have a close contact personal service business. All right, I answered that one. There's a question about testing positive more than once. There are a couple of reasons how this can happen. One is you have not cleared the virus yet, so you're still infected, and even though you're no longer symptomatic, you still are shedding virus. It's just not enough virus to make you sick. And this is known to occur in lots of people, and perhaps as long as 8 or 9 days past your last symptom. And that's why we have the restriction of staying at home at least 10 days past your positive test, even if you're asymptomatic. The other reason that you could have a second positive test is that you're reinfected. So we don't know if you're infected once, how much immunity you will develop or how long that immunity may last. And so it's certainly possible that as we go over the next few months, that people who were infected in March or April, if they don't practice the distancing guidelines and the safer at home orders, they could potentially get infected again and could have another positive test. So there are good explanations for why people have more than one positive test. Let's see. I think most of the rest of these are suggestions rather than questions. Someone said, let's see, I hope the testing for homeless is happening downtown, because once we open doors, there'll be more people getting in and out. This is not just a disease of, one population or another, except for those that are high at risk for bad diseases. So anyone who is out in the community is at risk of community transmission. And there is plenty of testing available. When I ran the statistics in a 5-week period, the number of tests performed in Mobile had gone up. The weekly average had gone up 396%, and we had the number of positives had stayed relatively the same. So we know there's plenty of testing out there. And again, this week at the 8 or 9 Mobile County Health Department locations, anyone who thinks they need a COVID test can get a test regardless of their ability to pay. You just need an appointment. And if you come to one of our locations and you don't have an appointment, they most often will say, park right there and call the number and see if you could get an appointment if they're not busy. So lots of folks, if you need testing, you think you should get testing, please. If you can't get it anywhere else, call us. And I believe that is all. Is there anything, Mark, sort of last minute?
One thing, have we ever done on the an aggregate total of cases from congregate locations like the jail, public housing, nursing? Has that ever been broken out?
The number of cases. So we report on the number of deaths.
In the congregate,
Yeah, in long-term care facilities or congregate settings. We report on the number of deaths, but I have not reported out. Oh, yes, I did. It's on here. So read the report that comes out daily, and I'll restate it here. So of the 1,559 that we're reporting on today, 252 or 16% were residents of a long-term care facility.
and they asked about jails or public housing, but
Okay, yeah. Those ones we have not broken out. In public housing, it's just a small number of cases, and the jail is doing really well. So they seem to have a good hold on what's going on in our large detention center. All right. So I will wrap it up for today. And again, thanks for tuning in. We're happy to be able to continue sharing these updates with you. Let us know on Facebook if you have questions, and we'll talk to you again tomorrow.